Hi, my name is Shanika Wilson, and for my individual informative assignment, I have chosen healthcare. I want to let you know that healthcare employs workers in professional and the service occupation. Together, they are three of the four in the industry, such as surgeons, dentists, registered nurses, and so on. There are many places in schools that you can attend to obtain the right training that you will need for whichever field in healthcare you choose to go in. A lot of jobs, they also have on-the-job training. As for instance, if you wanted to become a CNA or a GNA, you could go to various nursing homes or probably even a home healthcare setting to establish that. And also, such as hospitals, they tend to go a little bit farther with their training, such as a nurse's tech or a monitor tech. That training is a little bit more intense as opposed to a CNA or a GNA. You can then take a test through the state to become certified if you choose to. If not, you can just work as a nursing assistant, but your duties will be limited. Hospitals, nursing, and residential care facilities, such as offices of physicians, out of outpatient care centers, and ambulatory health care settings are two good places to go and seek employment. The second main idea I wanted to speak to you today about was some of the recent developments that have come about in the healthcare field. They have came up with new technology, with new procedures and new methods possible to increase infection control and to have less evasive surgical techniques as well. Doing that, it will improve the surgical rate for trauma victims and as well as the trauma patients. New developments that they have came up with, and for one example, is the handheld computers that some of the RNs, the CNAs, and the nurse techs will have to carry around that could record the status of their patient as well as take in the patient information. The third main idea I wanted to talk to you today about in healthcare is going to be some of the working conditions. Again, healthcare, when you're taking care of people, you have a clean environment. You have a well-lighted, a well-heated, or a well-cooled environment. Nursing facilities, they have a higher rate with patient care. So the precautions on your back strain and lifting, they really want you to limit that. And also, some of the new things are to minimize the exposure to radiation and to different chemicals that you can come in contact with. And to also guard the workers against communicable diseases such as AIDS, TB, also known as tuberculosis, and hepatitis B. For my conclusion, I just wanted to tell you about that was some of the main things in the healthcare. I didn't really want to mention the pay, but I did want to speak of, again, the training, the working conditions, and also the environment. I do thank you for listening, and I really hope that you show an interest in healthcare, and I hope you do further research. Thank you for your time, and have a good day.